I'd like to ask your permission to use this video for educational purpose on the
That's
internet.
right. Fine. Yeah.
Tell me about your symptoms before the surgery. What was bothering you before the surgery?
Well, the pain on my right leg would go down from my butt down to my leg, like sciatic nerve or whatever. That was like 2 years or so.
2 years you had that symptoms.
Pretty
1 to
much.
10. How bad was that pain?
Oh, bad enough where I couldn't sleep.
Yeah, like give me a number. 1, 10 being the worst
Oh
pain you
man,
have
I
ever
would
had.
put that right up 8, 9,
Right,
10.
8, 9,
yeah.
10. Oh wow, for 2 years.
Yeah.
And you did all the non-surgical treatment and it wasn't helping?
We
No?
did the pain thing, and that did help for maybe a little bit.
Okay.
You know, and I suppose the second time I had that shot or whatever I got,
Injection, epidural
it
injection,
it didn't seem like it helped much.
No, so it wasn't going the right direction.
And I believe you told me that.
Yeah.
You're going to come and see me, and I did. So.
Yeah. Now, about 3.5 months ago, we did the surgery, correct?
Correct.
We did this surgery. This was not a small surgery. This was a big surgery. We did a L2 to S1 fusion. Your spine was side bending. Your spine was pushing on the nerves. And do you remember the surgery?
Yep.
How long did you stay in the hospital after that big surgery?
About a day.
Just 1 day?
Yep. 1 day.
And after the surgery, when did you walk?
Oh, right
Same day,
away.
right
yeah.
away.
Well, they got us out the same day.
Yeah. Now, that sciatica pain that was going down the leg, how is it now?
That's okay. It's just
It's
a
gone.
little bit in my butt. It seems like a muscle pull
Yeah.
up here.
When
Other
did
than
that go away? When did that pain go away?
I would say right after the surgery.
Right after you woke up? Now, as well, you had some numbness in that foot, in the right foot. That numbness still a little there?
A little bit.
So is it getting better though?
I would say it is. Yes.
Yeah. But you had something new. Tell me about it.
Well, the left leg,
Yeah.
my left leg is numb from about the calf down through my foot.
Yeah, and that is actually, I'm going to show you why you have that.
Okay.
This is a model of the spine. And you see those nerves? Your problem was that the material of the disc was pushing on the nerve. That's why you had the problem on the right side. Now, in the surgery, I actually had to push that nerve to the side to go from the left side to put a spacer in. That spacer I'm going to show you is that spacer right here.
Okay.
To do that, I had to push that nerve to the side, and your spine was so in such bad shape, and that nerve was so irritated already before that it got a little angrier after the surgery when I pushed it to the side. About 1 in 7, about 15% of our patients get that. But in most of the time, when they get it, it is like what you're describing. It's just a numbness, but it usually gets better. How has it been doing, that numbness on the left side, in the last few weeks? How has it been doing?
Oh, maybe a little better than we had after the surgery. Maybe a little bit better. So it
So-
seems like it's improving.
Yeah, usually that takes few months for that to get better, and that is that obviously a side effect of the surgery, because I have to push the nerve to the side. Now, what you need to know in an open old-fashioned surgery, I'm going to turn around this again here. We go in this direction here, right there. We push on the spinal cord, and we push on the spine and the nerve that's coming out.
Okay.
There is actually about 8.7% risk that we nick the spinal cord. That risk with us, with our surgery, is 0. And most of the studies show as well somewhere between 1 and 35%, so that varies a lot, that even the nerve on the side can get literally irritated. And there is actually a risk that that nerve is even permanently damaged in the open surgery, as well in our surgery. But in our surgery, even though we don't put the spinal cord at the danger, we still put some pressure on the nerve root, and that risk seems to be actually the 15%, but most of the time, that 15%, most of the time is mostly the bottom disc, so overall is maybe even a little less than 15%. But most of the time it is like that, just some numbness that gets better. Sometimes, unfortunately, with open surgery or with our surgery, that risk can be even that that nerve get damaged. Thanks God yours didn't.
Okay.
How much is it bothering you right now, that numbness?
It's not really bothering. It's just feel the numbness.
Yeah. And sometimes before the numbness get better, people tell me they feel like a jolt, like electricity in the same area. That is when the nerves are connecting. That is a good sign.
And that's what I feel every now and then. Once in a while, it'll feel like somebody's got a shock down
Yeah.
there, just a jolt.
People they are sometimes are concerned about that, but that's actually a good sign. That means the nerve is healing, the nerve is connecting, and usually when those jolts happen, few weeks later it start getting better and better. So even though it's troublesome, that's actually a good sign that the nerve is recovering. Okay, it is same like itching for an incision in your skin. If you have itching, that means that the wound is healing. Yeah. Now I'm going to go over this. This surgery that we did for you was actually we did that surgery in about 1.5 hours, and our blood loss was just about less than about a half a cup of coffee. That's all we lost blood during the surgery. That would have been unimaginable with open old-fashioned surgery.
Right.
But obviously, and the bone is starting to grow in many places. The bottom one, still working on it. But and as well, you had some side bending of the spine that is significantly better now. So overall, this was a really good surgery, and we achieved the result of the surgery. It's still healing, but 3.5 months is really not much in spine work.
Okay.
So overall, happy so far with the results?
So far, yes.
Yeah. So still, maybe this summer, don't do anything excessive. Let the bone become stronger. But I'm sure by winter, you're ready for all winter activities, okay?
Okay.
Thank you so much for the interview. I
You bet.
appreciate that.